have to do something.
Okay, so I did a quality improvement project to reduce hospital-acquired pressure ulcers. My reason why I chose this is because as patients, nurses take care of them like throughout their admission. And pressure ulcers can interfere with patients' health, and recovery time may be complicated by pain or infection, which could lead to a prolonged hospital stay. And as nurses, like when they get admitted, like you don't know what the pressure ulcer looked like to begin with, or if it's getting better or not. So like we could like upload pictures like at admission, and then like a few days later, if it's like looking a little worse, we could upload like as it changes. And then my aim statement is to achieve 75% reduction in hospital-acquired pressure ulcers on medical surgical at a Barracuda piece by June 1st, 2023. My implement process, education with staff to ensure everyone is charting, documenting correctly the first month the project is implemented. We'll still utilize the interventions that are already in place, such as your repositioning every 2 hours, encouraging a healthy diet, the Braden scale, and etc. Patients being assessed upon admission and identify whether or not the patient is at risk for a skin breakdown. And then policies such as assessing patients' nutrition and hydration, reassessing skin daily, and managing moisture, which those policies are already kind of like set in place. Implementation team, forming a team to ensure that efforts and responsibilities are being continued, having different roles for improvement activities, decision making, and monitoring progression. Team will meet every month to evaluate the new interventions and make any changes if needed. I feel like a monthly meeting just to like catch up with everybody would be a goal to recognize all existing pressure ulcers and prevent skin breakdown on patients that are admitted to medical surgical, provide treatment for existing pressure ulcers and preventative care for those patients at risk, and use and adapt to those tools and resources that were implemented in this project. And all team members are on the same page with documenting and interventions of pressure ulcer prevention. This is like what I created. Like we could take a picture to begin with, and then as like different nurses take care of this patient, they know what it looked like to begin with. Mm-hmm. And then to see if the interventions that we have placed are working, or do we need to order like a new cream, or would a powder benefit more? And then of course still doing your Braden scale and your wound care charting. As long as like we educate like how to properly chart those, I feel like those are still like good protocols. Strengths and weaknesses. Strengths, they already have some pressure ulcer protocols in place, like position changes, nutrition, hydration, skin care products, and we are aware of the risk factors of pressure ulcers. Weaknesses is how compliant the patient is with the position, like the interventions that we set in place. Like I said, some patients refuse to do like interventions just because they're uncomfortable maybe on one side than the other. And then these are just some other research articles that I came across that are kind of like similar research that I've done. Like this one had like cards that they wrote up and like pictures of like the severity of pressure ulcers. But yeah, it's interesting. That's all I have for you.